Every time you make a fist, wave, or pick up an object, 27 bones move in perfect harmony. But have you ever wondered how these bones are arranged? How do they fit together to give your hand both strength and precision? Let's dive into the osteology of the wrist and hand. The wrist consists of 8 carpal bones which are arranged in 2 rows, the proximal and distal rows. In the proximal row, we have the scaphoid, which is boat-shaped and is the most frequently fractured carpal bone. There is the lunate, which is moon-shaped and is the most commonly dislocated. There is the triquetrum, which is pyramidal-shaped and articulates with the pisiform. The pisiform, which is a P-shaped bone, is a sesamoid bone within the flexor carpi ulnaris tendon. In the distal row, we have the trapezium, which articulates with the first metacarpal at the base of the thumb. There is the trapezoid, which is the smallest bone in the distal row. There is the capitate, which is the largest carpal bone central in the wrist. And finally, there is the hamate, which has a hook-like projection called the hamulus, which provides muscle attachment. The metacarpal bones form the palm and are numbered 1 to 5 from lateral or the thumb side to the medial or the little finger side. Each metacarpal has a base, a shaft, and a head. The first metacarpal is shorter and more mobile. The second and third metacarpals are rigid and form the stable central column, while the fourth and fifth metacarpals allow more movement for grasping. The phalanges are the bony framework of the fingers. There are 14 phalanges in total, with each finger having 3, the proximal, the middle, and distal, except for the thumb, which has only 2, the proximal and distal. The distal phalanges have tufts that support the nails. The wrist and hand bones provide structure, support, and mobility for complex movements. Understanding their anatomy is essential for medical practice.